Hello friends, I'm Dr. Shunitra Roy Hajra. I'm a pediatrician and today I'm going to discuss about very important topic, that is the frequently asked questions about the vaccination. Please like this video, subscribe to my channel and let me know if you want to know more about vaccination or any other child health related topic. I have divided this contents into three parts. First, I'll discuss the most frequently asked questions regarding vaccination which the parents ask to a pediatrician. Then I'll discuss a bit about the National Immunization Schedule and the last IAP Schedule. Let's get started. So, first question is, what are the vaccines and why do I need to vaccinate my child? So, vaccines are probably the most useful and cost effective public health tools known to the mankind for preventing diseases. They are complex biological agents which give the child immunity against a particular disease without the child getting sick. They contain either the weakened disease causing germs, which are either killed or attenuated, or a part of the disease causing germ. Apart from the antigen, vaccines also contain some other components such as adjuvants, which can increase the potency of the vaccine, stabilizers, which increases the stability of a vaccine, and additives, which are added during the manufacturing process. Remember that investing money in vaccination is a much wiser decision than spending money on ready-made baby foods. Once a child suffers from an infection, parents not only have to spend a huge amount in treatments, there is also loss in number of school days, absenteeism from the work of the parents and other social issues. And due to the emergence of antimicrobial resistance and other cause, we cannot guarantee successful treatment tool for all infections. Okay, so these biological agents, they boost our immunity by acting as antigens and give us a protective antibody against them without actually producing the disease. The next common question which comes to our mind is, how does these vaccines work? So whenever any disease causing germ enter our body for the first time, three things happen. Our body recognizes the germ as a foreign invader. Then our body's immune system gets activated, which by producing antibodies try to kill or inactivate the germ. These protective mechanisms help us in recovering from the disease or sickness caused by these germs. Once our body recognizes these germs as a foreign invader, it remembers this information. Hence, when the same germ tries to invade our body for the second time, our body starts producing antibodies immediately and prevent us from getting sick. This is called as immune memory. Thirdly, how does this vaccine work? So, during vaccination, the first step, as described earlier, is replaced by vaccine instead of the germ, and the immune memory follows. Vaccines make our body competent enough to produce immunity, that is, antibodies against the germ without causing the disease. This immunity helps us from getting the disease when we are actually exposed to the disease causing germs. The third question is, when to take our children for vaccination. So there are various vaccination schedules available in every country depending upon the need and timing of various vaccines for that population. So this vaccination schedule will start from birth and then it is present at frequent intervals till 10 to 16 years of age. The vaccination schedule, which is followed by the Government of India, is known as the National Immunization Schedule, and that which is followed in India but mainly in office practice is known as the IAP schedule. There are certain extra vaccines included in this schedule. This schedule, the formation of schedule depends on the disease burden, availability of safe and effective vaccines, and the cost and logistics. The schedule tells you age wise which vaccines our children need to give at a particular time. Lot of efforts are put in preparing these immunization schedules considering various factors including the earliest age at which a particular vaccine is safe and effective. Often, in an immunization schedule, multiple vaccines are administered together to reduce the number of pricks and number of visits. Lot of experts put their mind regularly to update these schedules. So, a very common question which comes to our mind is that uh, do these vaccines confer lifelong immunity, and why there are so many vaccines of some? Well, there are certain vaccines which are capable to produce lifelong protections, but the decision about giving the number of doses of a particular vaccine depends on many factors, such as the type of vaccine used, specific disease epidemiology in a country, etc. Repeated doses are often required in cases of inactivated vaccines, especially like that of DPT or other inactivated vaccines. These are required because, in case of inactivated vaccines, the immunity builds up in phases and each dose mounts a more powerful immune response than the previous one. Hence, most inactivated vaccines, multiple doses are necessary to confer a long, rather lifelong protection. In contrast, live vaccines produce a strong immune response even with one dose. But in a few live vaccines, such as polio, measles, etc., a second dose is given as some children may not take up the first dose well. So, due to this poor uptake, repeated doses of live vaccines may be necessary for some. So, is it possible to get a disease even after complete immunization schedule? There are many diseases such as typhoid, diphtheria, pertussis, Hib, pneumonia, flu, which results in providing only a short term protection even after full born illnesses. Therefore, the children in the above cases would require all the immunization as per schedule even after the illness subsides. Moreover, the vaccine efficacy varies. The efficacy can vary from 70 to 99%. That is why, even if the child gets a particular disease, then getting the vaccine schedule completed is a better and a very good idea, because the disease following complete vaccination will be much milder and it is the best way of prevention. A very useful and the most commonly asked question is that my child is afraid of vaccines. Does vaccination always mean injections? Harmful effects of so many injections. So, most of the vaccines are given by injectable routes, but not all. Some, like polio and rotavirus vaccines, are given as oral drops. Though there are vaccination for almost 20 diseases, it does not mean it giving it in a 20 number of times. Many vaccines are given as combination vaccines. Vaccines such as diphtheria, tetanus, whooping cough, etc. come as a single injection. Moreover, injectable vaccines are mildly painful, and that amount of injection are generally not harmful for the child. Recently, there are many less painful vaccines being available, and many researches are continuing regarding improvement regarding the method and technique of vaccination. That is why uh, researches are being focused on improving delivery methods of vaccine and minimizing pain caused by such injections. What are the things to remember before, during, and after a vaccination visit? So, first of all, which we should remember is to carry the vaccination card, because this is the way of documenting the completed schedule and the leftover schedule. Any problems which happened with vaccination in the past, like allergies or anaphylaxis or any side effects, should be reported to the doctor or the healthcare worker prior to the vaccination schedule. Any serious side effects, like that of high grade fever, convulsion, inconsolable cry, etc., might occur in certain cases, though these are very rare, and they should be kept in mind and they should be told prior to the vaccination schedule. These vaccination visits are generally well baby visits. So, every parent should take this opportunity of well baby visit to check for growth and development of their babies. So, it is always advisable to the parents to get their height, weight, and head circumference checked during this vaccination schedule. What to do if there is a delay in vaccination or if there is a missed dosing? It is important that your child gets vaccinated at a specified time. The schedule is based on the risk of getting the disease. This means that in case you miss or delay the vaccine of your child, the child is exposed to the risk of the disease during that time. But in case you miss the date, then get it done as soon as possible. Please remember that it is not necessary to start the schedule all over again. Get your child vaccinated and complete the rest of the schedule. Vaccination are the best way to prevent a disease. No vaccine is 100% protective. Rarely the disease can occur even after vaccination. Even if the disease occurs in the vaccinated children, the severity of the disease is significantly milder. Is it necessary to take vaccine for a disease for which the child has often suffered? As already discussed, for some diseases like measles, chickenpox, which confer lifelong immunity or a long time immunity, it is not necessary to take the vaccine after the child has suffered from the disease. But for those diseases like diphtheria, pertussis, pneumonia, which produce a very short term protective immunity, it is necessary to repeat or to complete the immunization schedule even if the child has suffered from that particular disease. What are the side effects of vaccines? Can they be very serious? And parents have heard that polio is associated with impotence and measles is associated with autism. So, is it worth giving those vaccines? So, most of the vaccine reactions are very mild and includes local problems like pain and swelling in the area or mild fever, like particularly that in case of the DPT vaccination. But however, certain cases, certain serious side effects are being reported, like that of high fever after vaccination, if the baby turns unresponsive or limp, if the baby continuously cries for more than 3 hours and that is inconsolable, and if the baby has convulsion. Secondly, there can be allergic and anaphylactic reactions, which are the most dreaded ones. Though these are very, very rare, but there are chances of the baby getting these reactions. But autism is not associated with measles. Sometimes toxic shock syndrome has been seen associated with measles vaccination in rare cases. Similarly, polio is associated with vaccine associated paralytic polio, but it is not associated with any impotence. However, in spite of the side effects, if we consider risk to benefit ratio, the benefits of giving vaccines and protecting the child from that particular disease is much more advantageous, and as a result it is worth taking the risk, which is very, very mild in nature. Is vaccination necessary during mass campaigning, even if after completion of the full vaccine schedule? Well, mass campaign vaccination is to control transmission of the disease by administering the disease at a very large scale. This is for production of herd immunity and not for individual protection. So, even after completion of schedules, these additional doses need to be given. The aim of vaccination schedule, as already said, is to control the transmission for eliminating them by using the same vaccine in a very large population, whereas in routine immunization is to protect the individual child from the disease. The whole purpose and effort put in a mass campaign will be wasted if you do not vaccinate your child during that time. This should be considered as an additional dose of the vaccine, which will be useful not only for a society but also for an individual child in improving his or her immunity against the disease. We actually need to be thankful to nature for providing such an unique immune system which could identify millions of antigens separately at a time and mount protective specific immunity against each and every antigen given in the form of vaccines. Compared to the enormous potential of our immune system has, we are only giving a few, around 20. Therefore, irrespective of counting the vaccines, we need to count the number of disease against whom we can protect our child by using these vaccines. So, we should definitely get our child vaccinated during the mass vaccination campaigning. Now we have come to the end of our discussion topic, and that is to discuss about the various schedule. So national immunization schedule is the schedule which is followed by the government of India, almost all of the state with certain variation in few states depending on the epidemiology of these diseases. This vaccination schedule will start from birth dose and will continue to 10 to 16 years of age and also in the pregnant woman. Similarly, IAP schedule is the schedule which is followed in the office practice in India, which again starts from the birth dose and continues till 10 to 12 years of age. There is certain extra vaccination given in the IAP schedule, like that of the pneumonia vaccine, that of the chickenpox vaccine, flu vaccine, typhoid vaccine, hepatitis A vaccine, and meningococcal vaccine, and certain other special vaccines which may be needed in special children or special circumstances. So, thank you for your patient hearing. I'd like to get some more questions and some more ideas regarding my next video update. Thank you very much.